Here are 5 signs you might have IT band friction syndrome and how we like to treat it at the Running PTs. This is not intended to be medical advice. Go see your physical therapist and get an evaluation. Let them decide what treatment is best. Sign number 1, pain on the outside of the knee. Not underneath, not in front, outside of the knee. Sign number 2, pain so bad that you have to stop running. IT band friction typically presents with sharp pain on the outside of the knee to the point where you have to stop running during the run because it hurts so bad to continue. Number 3, have you been intentionally running slower prior to getting injured? Running slower increases the risk of IT band friction slightly. When you run slower, there's typically a little bit more vertical oscillation, so there's more knee flexion. When you have more knee flexion, it allows time for that IT band to scour the outside of the femur. Sign number 4, increased pain with downhill running. The IT band typically hurts more with downhill running than flat or uphill. The reason is the same as when you run slow. When you're running downhill, it's a quad dominant movement pattern. There's a little bit more knee flexion as you go downhill to control your center of mass. That allows time for the IT band to scour the outside of the knee, and it puts more load on the knee itself. So typically running faster or running flat is gonna feel a little bit better for IT band friction syndrome than running downhill. Sign number 5, rest helps, but the pain comes back about 1.5 miles into your run. We see this all the time. Typically when I see patients in the clinic, they have rested for about a week and then they go out to run and the knee feels good and then they start to experience pain about 1.5 miles into the run. That is a classic sign of IT band friction syndrome. The reason behind that is the driver behind the injury has not been addressed yet. So typically how we treat IT band friction syndrome, number 1 is hip strengthening. Evidence supports hip strengthening for IT band friction syndrome. We like to do exercises that in particular strengthen the glute med. Side plank leg lifts are a really good option for hip strengthening. Single leg balance exercises, bonus if it's a single leg balance exercise that is also strengthening the hips at the same time. When you run, you're always on one leg or none. You're never on 2. So it's important functionally to strengthen the hips when you're on one leg. This can oftentimes help control the knee, and controlling the knee can help to eliminate IT band friction syndrome. Run form modifications. This is a big one. It's hard to say exactly which run form cue is going to help with IT band friction syndrome. The most common things we see are midline crossover and increased knee flexion. Those can be independent of one another, or we can see those together. So things like widening your stance, shorter, quicker steps, standing up tall. Those are just examples of things that help with IT band friction syndrome. Sometimes orthotics are indicated. What an orthotic typically does is it brings the ground up to your arch. It brings the ground up to your foot, which prevents the foot from rolling in excessively. When the foot rolls in excessively, that creates internal rotation at the knee, which actually increases tension in the IT band, thus increasing pressure on the IT band on the outside of the knee. So sometimes we like to treat IT band friction from the bottom up with an over-the-counter insert or a custom insert. Those are case dependent. And last but not least is dry needling. Dry needling just simply works for IT band friction syndrome. The needle can do things that our hands can't do, and we find that a lot of patients get relief of their IT band friction when we dry needle. And please don't try that at home. Only a licensed PT should be the one dry needling your IT band. Check us out at therunningpts.com.